Thank you for staying with us. Cholera is a severe bacterial infection causing extreme diarrhea and dehydration, mainly spread through contaminated water and food. The current outbreak in Nigeria has resulted in over 1,500 suspected cases and 53 deaths. Symptoms include sudden watery diarrhea, dehydration, nausea, and vomiting. Treatment involves rehydration therapy and, in severe cases, antibiotics. Prevention focuses on improving sanitation, access to clean water, vaccination, and raising awareness about the disease. Joining us in the studio is an Ashoka Fellow and Executive Director, Health Emergency Initiative, Pascal Ajenini. Good morning. Thank you for joining us.
Thank you for having me.
And from our Abuja studio is a public health expert, Dr. Isaac Uja. Good morning. Thank you for joining us.
Good morning. I'm glad to be here.
Now, let me begin with you, Dr. Uja. If you look at the papers this morning, there are reports that cholera has spread to Kirikiri Correctional Center, afflicting 25 inmates. And Katsina has recorded 118 suspected cases. Lagos State has said that there are no outbreaks or cases recorded in the last over 70 hours, so to speak. But talk to us from your perspective. This current matter we are facing with cholera, what do you think is at the heart of it?
Well, I think we should still be concerned. The case of Kirikiri prison is an issue to be worried about because I'm not quite sure that that place has good environmental and environmental hygiene and sanitation. As you just mentioned a few minutes ago, cholera is spread by contaminated water, dirty or unhygienic environment, and in a place where people are many and are crowded and they are probably sharing the same source of water. The possibility of spread is high. So we should be worried about those kinds of places. You also report about another state that is still experiencing the outbreak. We should look out for other states that have not reported, that we have not heard anything from them. Doesn't necessarily mean that nothing is going on there. We should be worried about what's going on there. And the health personnel in those places should please mount their surveillance and be sure that they catch any cases that come on. I'm glad to hear that Lagos has not reported any case in the last 72 hours. That's kudos to Lagos State. Generally, Lagos does very well. They respond very well to outbreaks. They did excellently well during the COVID-19 pandemic, and they have been quite exemplary.
And back to you in the studio. From the records that Lagos State has not recorded any case in the past 72 hours, so to speak, how will you say our health system have been able to manage this incident, not just in Lagos State, and what will be the long-term implication if this continues to go on?
It's commendable to hear that there has been no fresh case in the last 72 hours. I'm also aware that in our interaction with some of the facilities, there were some deaths recorded, which was publicly acknowledged. But we need to get to the root cause and how do we minimize or mitigate in the future? Because has the cholera spread completely gone off? No. If there could be a sudden spark at Kirikiri, it means that no information, it could happen from any other location because our data gathering and our data mechanism of storing and sharing data is very weak. But I want to also go back. Lagos is making a number of moves around putting in place public toilets because if you recall that Nigeria has one of the worst records in open defecation.
Absolutely.
And most of the transmission happened through feces that people pass. And Lagos is a coastal state. So how effective are those measures? And are they just temporary measures? Are we going to go back to this in the future? But I want to also underscore the area that concerns community engagement, relying on the public health extension workers and others who mingle with communities. Because many, with the despair in the land, with the trauma people have been exposed to in recent time, many would typically pay little attention to those preventive measures that would minimize the chances of infection. So the public need to be engaged, and the people who, these community health workers, and mechanisms. I just also want to relate it to Ebola and COVID. The template that was used to ensure minimal deaths during those outbreaks should be introduced much more. And I feel that one of the key areas, many people are very careless with how they eat, because, I mean, people are hungry. So if you see anything, you just grab and eat. People don't wash their hands. People do not use hand sanitizers. And then the toilets and the water people drink particularly, that's a major channel of transmission. The water people drink, most of them are not safe. So what steps, in addition with what government has done so far, what steps are being taken to ensure that people can access safe and good drinking water?
That's the big question that I'll be posing to you, Dr. Uja, because one of the key issues that even I think UNICEF said, or WHO said, was the provision of potable water for people. And you know, across Nigeria, a lot of persons actually provide this water by themselves. They do not get access to government-provided water as it is, and most of the sources of this water are not as clean. How then do we address this when government is saying we need to create awareness, keep our environment clean, and use clean water, yet we do not have access to potable water?
Yes, I think this is a serious case for concern. I personally am not satisfied with the amount of effort put forth by authorities. Sensitization and mobilization of communities is very essential, and we're not having enough of that. There are many communities, even now that we are having a cholera outbreak, who still don't even know what's going on in their neighboring states that are affected. And that's a cause for worry. I think that the government should invest more. It is an investment on water and sanitation, rather than focusing on buying vaccines. Not that vaccines are not good, not that they cannot be used to prevent cholera, but for me, the priority should be environmental sanitation, potable water, in other words, safe water for everybody to have and drink, because if you don't do that, this cholera outbreak will continue to be reoccurring. This is not the first time, and if you don't take the appropriate actions, it will not be the last time either. And that's what we should try to prevent. I believe that if the federal government, the state government, the local governments are doing as much as they should do, this problem can be reduced to the barest minimum. And I also want to remind us that the provision of clean water, potable water, safe water, and environmental sanitation are part of the Sustainable Development Goals, of which Nigeria is a part. And we are only 6.5 years away from the target, which is 2030. If we are having these kinds of problems now, it shows that we have not gone anywhere and that we still have a lot to do. It is very worrisome that we are still practicing open defecation. There is hardly any state, including Lagos State, where there is no open defecation going on. And especially this time of the year when it is raining and water is carried from, the feces are carried by water to sources of drinking water, and therefore those sources are contaminated. We should be worrying about our sanitation, we should be worrying about our environment, and also about our behavior. I want to repeat and also remind us that cholera is vaccine preventable as well as behavior preventable. If we are concerned about what we eat, how we eat, we wash our hands frequently before we eat, and we wash the foods that are not cooked, like fruits, vegetables, and so on, and make sure that they are clean, and make sure that the foods we cook are well cooked, we serve them in clean plates, and so on, we would eliminate cholera. If you notice, developed countries that are not experiencing cholera are not doing so not because they are vaccinated, but because they maintain good personal and environmental hygiene and sanitation.
So, taking it up from what you have said, amongst some of the factors that have led to, the increase in the rise of the outbreak, you mentioned earlier about Nigeria not having enough strength as regards data gathering, and this is why we may be having some of these incidents, especially in the prison. But let's not also forget that it's also, subject to early presentation of Nigerians, especially in cases like this. And what do you make of some persons that will say that it's not as serious as the COVID-19, it's not as serious as the Ebola outbreak also?
So look at it in the following context. You asked earlier about outside Lagos, and even in Lagos, there are some locations that access to the hospital may not be as quick as 10 or 20 minutes, whether by public transport or you're driving yourself. Then outside Lagos, there are places or local governments that may just have only one public hospital, and the people infected may not get to that hospital until after 2 hours or more commute, especially where you have vast expanse of land in northern parts of the country. So we need to look at the care given at the health facility and care that can be offered in the event that it happens in the night, perhaps due to challenge of insecurity, persons cannot be transported to the nearest health facility. So the health education first will include the oral rehydration therapy that can be provided in the interim. So people must know about that, because the interval before when somebody is infected seriously, it can happen in less than 24, 48 hours. The person could die because, of course, the loss of fluid and the dehydration is huge. So what I'm going to add it is, we must dimension what must be done through health education to educate people that, one, this is not yet over. And I want to quickly add, most times somebody may have been infected, but for 1 to 10 days, the symptoms have not manifested. So such person can also potentially infect others, either through feces or contact. So it's important to know that even if you come to a locality or an area and people have not recorded any deaths, some may have potentially been exposed to that. So it remains very important that what should be done at home, what should be done when you get to the health facility, and even for health workers, it's very important to emphasize that we need to equip them with the personal protective equipment, hand gloves, gowns, to ensure that the fluid does not get them also infected. So I still feel that the behavior, we had a program last week, we trained in the 6 health districts in Lagos. We brought their community health extension workers and trained them. So one of the things we introduced in that program was to play a video to further enlighten them on what to do, how to engage communities, video on what's the symptoms, the management, and the preventive measures. Those things should not just only be by health workers, it should be in schools. And I also want to emphasize, based on what Doctor said, public-private partnership was critical in overcoming Ebola and COVID particularly. This is a time government must also go back, engage with the private sector, social sector, other philanthropies. When any part of the system is weak, it affects the whole. So we must, at this time, wake up. So, okay, let's work together to make sure that we bring this down. And there are things that require immediate action. There must be locations and areas in wards, local governments, in different communities where people can access immediate water, because water is even expensive. Whether you're getting the one from the borehole or so, people can access good water. So in addition to measures to deploy toilets in public spaces, there must be measures to, so, okay, government may identify those who have boreholes, private boreholes. Okay, we are giving you temporary support to ensure that people can access fairly good water. We may not say very safe, but that would minimize the spread. That would minimize transmission. But above all, people must not think that it is over, because maybe, as reported in Lagos, there had been 3 to 4 days of no transmission or new infection. We must really, really keep the surveillance very active than before.
I'd like for you to emphasize the matter of the spread in terms of how people contract it as it is, because some persons do not really understand how it is contracted from persons who are infected.
Okay, first is it comes from your touch, your not washing your hands, and the touching an item that had been exposed to it. Flies perching on your food can also be, yes, it can be transmitted through flies. So if you have food anywhere, cover it. Secondly, if you're using open toilets, or your open toilet or defecation is a very major transmission channel. I also want to emphasize on fruits and vegetables. So as much as is in you must not just even, it's not an option, use salt to wash your vegetable, or wash it thoroughly in the minimum. Your fruits, make sure you peel it, and don't eat the fruit as you just get it. You get to a place where they are saying grocery, you just grab the carrot,
just wash.
Yes. And some of them fall inside the gutter, and they pick them and put them back. So those are measures that will be taken urgently to minimize infection.
But when people get in contact with someone who is infected, how do they contract the virus? Is it possible? A handshake, whichever?
Yes. If you touch someone who has been infected, or who with the flu, especially with the germ or it comes in liquid now. So if you have contact with such a person, that's why we're emphasizing use of hand sanitizer, use of washing your hand at least, just the way we're doing during COVID. I think on my part, people in my ecosystem, we've imbibed that everywhere you go, come back, wash your hands for at least, with soap, with at least 1 minute. For about 1 minute, to ensure that you are shielded. Yes. So, and I want to also emphasize that, interestingly, as doctor said, not more than 1% of people who are infected die if they are presented early in the hospital. But over 50% die if you're managing it at home or you're not getting a proper care. So just imagine the gap, 50, 100, and 1%. And the death is so horrible. The person would just, in less than 48 hours, pass out if there's no immediate care.
And that's why I was trying to talk to you about individual attitude to this kind of things, because so many persons resort to self-medication, and that's why I also mentioned that some persons say it's not as serious. So at what point exactly should the individual say, okay, I should be able to differentiate that, okay, this is not just my normal running stomach and cholera, this is cholera?
So it comes with consistent stooling and vomiting. Those are 2 major areas that shows is to be pouring like water. So, and it's not just only for maybe people that live in ghettos, as the case may be, or a particular low-income area. Someone came from Canada a few weeks ago, from what was reported, and she got infected and she died about 2 weeks ago during the public holiday. So it is something, those are the 2 major symptoms that will show. It can eventually, ultimately affect the kidney, but stooling, vomiting, or diarrhea, as the case may, diarrhea and vomiting, and it comes very, very horrific in the way and manner it hits the patient.
All right, let me come to you, Dr. Uja. Government's efforts at addressing this matter. The government has set up Emergency Operations Center to look into these issues. You mentioned earlier the matter of vaccine. As it is, there are reports that Nigeria does not have vaccines at this point. Perhaps you need to look at the situation on the ground, how government is handling it, the gaps that you are seeing that needs to be addressed immediately, so that we can begin to see the kinds of results that we desire. We know the rains are still very much with us as it is, but then what more should the government be doing to close the gaps in its effort to address these issues?
Well, let me start by commending the Nigerian Center for Disease Control. The center they have set up is commendable. It shows that they are working and they are ready to handle new cases. But generally, you will agree with me that majority of Nigerians do not have safe drinking water. And they do not have a good means of disposing their feces. It is sad that we would still be talking about open defecation at this time in the 21st century. Every household should have a toilet. And the gap that I see is that, I mean, a pit latrine is not difficult to do. If you can't have running water, at least we can have boreholes for communities. We can also have big tanks mounted in communities to which treated water, safe water is supplied, and from which water is reticulated to the people in that community. If the source of water to a community is guaranteed and is safe, then it means that everybody in that community that is using the water will be protected. I think that if we really put more effort, we can have at least one toilet per household, and we can have boreholes everywhere so that everybody has access to safe drinking water. You notice that even as close to Lagos as Ogun, or even the rural outskirts of Lagos, people are scooping water from any source they can find and using for sometimes washing clothes, sometimes drinking, sometimes for cooking, sometimes for doing other things. We are talking about washing foods before we eat. Do you know that most of the time, the water that we are even talking about to be used to wash the fruits, vegetables, before we eat is contaminated? So what are we talking about if the water is not safe? Washing is then a ritual. It doesn't do any good. So the gap that I see is, one, we should step up on environmental hygiene and sanitation, if possible, between the federal, state, and local governments. Let's see how we can have at least one toilet per household. Two, water, provision of water. If we cannot have pipe-borne water like we have in cities, can we try and have boreholes in as many as rural areas as we have, as we can find, or that we can reach, where people dwell? If we can do that, and make sure that we step up our campaigns on sensitizing people to observe personal hygiene, environmental hygiene and sanitation, we will stem the tide of cholera. We know what is going on. We know how it can be prevented. Therefore, what we should do is to work on how it should be prevented. And that's where I have a concern that what we are doing at the moment is not enough. We should do a lot more than we are doing.
And talking about doing enough, another quick way that this might spread is through the schools. There are concerns that since we had to shut down some schools during the COVID-19 and even the Ebola period, we should also address this the same way. But talk to us about ways that schools can be equipped to manage this incident. The low immunity of children will make this easier to spread among themselves.
Yeah, when it happened in Southern Africa earlier in the year, Zambia, other Southern African countries, schools, even Kenya, schools were closed for some weeks. People have actually canvassed for that. Of course, also bearing in mind that we have about 2-3 weeks for the academic session to come to a close. But I think with the trend so far that the fatalities are minimal, and it will be helpful for the school authorities to embrace these safe practices outlined, ensuring that children, they can play and all of that. So ensuring that every school, and this is not just for the school authorities, Ministry of Environment and other agencies involved in this, all collaborating to ensure that there is significant level of compliance with these safe measures. I think that's the minimum between now and the next 3 weeks, hoping that before the new academic year starts, we would have addressed this and brought it to a halt, because it's unsafe to operate in a society or community where there's outbreak of cholera. So I think that's the immediate, these little steps, having hand sanitizer, having running water, ensuring there's soap for children to wash their hands, and having the form teachers, etc., to educate them and ensure compliance, that would be very helpful at this stage. Yeah.
Thank you very much. I'm hoping that the next time we are set, Veronica will be having our
hand sanitizers
just
as our
so
we have our guests, we hand it over to them.
Hand it over.
Clean your hands. Anyway, let me come to you now, Dr. Uja. Still talking about addressing this issue. The government has said that people should stop patronizing unregistered eateries, restaurants, as it is, and then the matter of persons who sell fruits, perhaps not using, not checking their sanitary measures. Should we begin to clamp down on all of these spaces now, as it is?
Why not? Why not? I agree with my panelists there in the studio that we don't need to close our schools for now, but we need to be vigilant. And the issue of restaurants or eateries should be very seriously looked at. If people are hawking foods, if you notice now everywhere you go, you see fruits, vegetables being sold by the roadside, you see water running on them, you see people selling fish, selling puff-puff, selling bread, selling anything they can possibly sell so that they can make ends meet. I do not condemn people for hawking, but at this time, I think we should be more careful. And if possible, if we need to ban, why not? If this is a source of our problem, and it could be, especially for travelers, those who are traveling should be very careful. Yes, you may be hungry because you are traveling for a long period of time on the road and there's no food for you. And what you probably find is a restaurant, mama put, whatever it is. But if you know that that could be a source of your problem, health challenge, why don't you avoid it? Why don't you carry something like bread or biscuit and a bottle of water if you are traveling, so that you make sure you don't stop somewhere to eat on the road and get into trouble? Restaurants generally in our country here are not properly maintained. I mentioned recently that if you go to the back of those restaurants that you eat from and you see how the plates are washed, even the foods that are cooked, how they are cooked, what they consider wash, if you see what's going on there at the back and you come to the table where the food is served, I tell you, you will lose your appetite. You will not eat. So if there's a ban or at least a restriction or a surveillance of those sources of food for the public, at this time of emergency, I think it will not be out of order. We need our environmental sanitation people. We used to have them when some of us were young. They used to go to markets, they used to go to public places and make sure that food served to the public were clean. We do not have them now. We do not see them. But when you see some school curricula, you notice that they are still teaching. Where are the people?
That's the big question, Dr. Uja. We only hope that perhaps the government will look at maybe resuscitating or bringing back these people so that they can do the needful at this point. We need to, wrap up our conversation here now. Dr. Isaac Uja, public health specialist, thank you for your time, as well as Pascal Achunini, Executive Director, Health Emergency Initiative, Ashoka Fellow. Thank you for your time as well.
Thank you for having me.
All right.
My pleasure.
Still to come on TVC.